Hello once again and welcome back. Let's continue our discussion on drug regulation and control. So this is part 2 of 3 of the three-parter series. If you haven't seen the first part, please go back, watch that one, and continue on to part 2 and then 3 next. Our learning objectives. So last time we've discussed the various legislation in pharmacy, the new drug approval process, and a little bit on the patents and generics. This time we're going to get into the marketing of drugs. So that's going to be OTCs. And we'll talk about the behind-the-counter drugs. And we'll get to know the scheduled drugs. Different 5 scheduled drugs. You'll know how many fills you can have and how many refills for each schedule.
Over-the-counter drugs do not require prescription. However, any over-the-counter drug does have to have adequate directions for use on the packaging. Easy enough where the customer, if they follow the directions, it would be safe for them to use. So on each packaging, besides the directions, it'll also include the name of the product, amount, any warning required, manufacturer's address, active ingredient, and direction for use. Thinking question. Why do some physicians write prescriptions for over-the-counter medication? If you selected cost covered by the insurance company, you would be correct. If there is a prescription for a drug or a durable medical equipment, then that would justify a medical need for that drug, even if it's over the counter. And many times doctors will write prescriptions for over-the-counter drugs so the insurance cover company will cover the costs. Which of the following is not required on the label of an OTC drug? If you selected all of the above are required, you would be correct. Behind the counter medications, BTC. Behind the counter medications do not require a prescription. However, it must be dispensed by a pharmacist or pharmacy technician. Some examples of behind the counter medication would be pseudoephedrine and pseudoephedrine containing products. That would be Sudafed. Claritin would be over the counter. However, Claritin D, which contains Sudafed, would be behind the counter. Likewise, Zyrtec over the counter. Zyrtec D containing pseudoephedrine would be behind the counter. Exempt narcotics, such as Robitussin AC, containing small amounts of codeine, which is a Schedule 5 drug. In certain states, you do not require a prescription. And then previously, Plan B, the emergency contraceptive, was available behind the counter, but I believe now they're changing that to over the counter. For pseudoephedrine, and this is due to the Combat Meth Act, you'll need to keep these records of any time you dispense pseudoephedrine for a minimum of 2 years. So name of product, patient ID, quantity sold, address, so you'll swipe their most likely driver's license, date and time of sale, and the signature. Which of the following is not a behind-the-counter medication? Correct answer would be none of the above. Insulin and insulin syringes. If a diabetic patient runs out of insulin, they will not require a prescription if they convince the pharmacist that they're diabetic. So show them an empty insulin vial and they should be able to dispense you an additional insulin vial. Also, insulin syringes. In use of the insulin, you'll require syringes. Convince the pharmacist you're diabetic, you need insulin syringes. You'll be able to get that behind the counter. Which of the following must be recorded when dispensing pseudoephedrine? The answer is all of the above. You'll need to document all those pieces of information. Sample label. This is a sample prescription only label. So by law, it must have that image RX only or the words federal law prohibits dispensing without prescription. This drug is also a C2, C in large print, C in Roman numeral 2 for Endocet, which is the brand name for oxycodone and acetaminophen. Note the storage temperature. Controlled room temperature is 15 to 30 degrees Celsius, synonymous with a cool place. Controlled room temperature would be cool. If the storage temperature required cold, that would be the refrigerator, and that temperature is 2 to 8 degrees Celsius. And if it required freezing temperature, between negative 10 degrees Celsius and negative 25 degrees Celsius for frozen temperature. Note the lot number and expiration and the NDC number, National Drug Code. National Drug Code has 10 digits. The first set of digits tell you the manufacturer. It's the manufacturer code. Second set of digits tells you the product code or the drug code. And last set of digits give you the package size. So it's a unique code for each manufacturer, drug product, and package size. Review questions. How many digits are in an NDC number? Correct answer, 10. What information does each group of digits of an NDC number provide? First set of digits, manufacturer. Second set of digits, drug product. And the third set of digits, package size. What is controlled room temperature? Cool storage. (15 to 30 degrees Celsius or 59 to 86 degrees Fahrenheit). Sample prescription label. Name and address of dispenser, that would be the pharmacy, and that would also be the service provider. Date field, also known as date of service. Initials of the pharmacist and technician. Refills remaining. Prescriber. Expiration date. Usually the default expiration date is 1 year from date of fill, but always double check the manufacturer's expiration date. Got drug info, in other words, the inscription. Got the directions for use, the signa, patient's name, and prescription number. We will file prescription based on this prescription number, and we'll file the controlled substances separately. Review question. What is the default expiration date on the prescription label? If you said 1 year from date of fill, you would be correct. However, double check the manufacturer's expiration date. How many refills are possible for the following drug schedules? C1, no acceptable medical use. C2, 0 refills. You must fill this prescription within 7 days. Schedule 3, 4, and 5. You have 5 refills within 6 months. Prescription only, those prescriptions are good up to 1 year. That's because we would like you to see your physician at least once a year. Controlled substance schedule, schedules 1 through 5. Schedule 1, no acceptable medical use and a very high potential for abuse. Examples include heroin, PCP, MDMA, which is ecstasy, and the hallucinogens, LSD, etc. Schedule 2, there is acceptable medical use and it does have a high potential for abuse and addiction. Schedule 2 drugs include cocaine, amphetamines like Adderall, morphine, and other opiates and opioids. Schedule 3, less potential for abuse than C1 or C2. On drugs like Vicodin, Tylenol number 3, with limited amounts of narcotics are included in this schedule. Schedule 4, the representative class drug in this class would be your anti-anxiety meds, benzodiazepines, Valiums, Xanax, drugs like that. Those would be Schedule 4. Schedule 5, very limited um, potential for abuse. Mentioned earlier, Robitussin AC, Robitussin with codeine as a cough suppressant, very small amounts. And Lyrica, that's for nerve pain. That's also Schedule 5. Technically, prescription only drugs, Schedule 6, and anything over the counter, behind the counter would be Schedule 7. Special consideration for Schedule 2 drugs. First, you'll require a perpetual inventory log. That means you'll need to know how many tablets, mLs, grams you have on hand at all times. You have to know. So if you get any in from your vendor, you got to add that to your quantities. And if you dispense any, you got to immediately subtract that from your stock. Schedule 2 also will need to be kept under lock and key. However, Schedule 3, 4, and 5 can be kept openly on storage shelves. However, don't put them all in one section. If there was to be diversion, you'd like to make it more difficult for the assailant. Schedule 2 also requires a special order form called the DEA Form 222. You only want to order Schedule 2 drugs on this form. Schedule 3, 4, 5, 6, like Vicodin, Schedule 3, you can just order that on your regular supply. Toilet paper, soap for the pharmacy as well. All coming from your vendor. So for the DEA Form 222, it's a triplicate. Um, you'll fill out the original form, keep copy 3 for your records. You'll send copy 1 and 2 to the vendor. Only when the vendor has a hold of the 222 form will then they actually will send you the C2 drug. So they have to have the 22 form in hand before they can actually ship you the C2 drug. They'll go ahead and forward copy to the DEA as the paper trail, and they'll keep the original copy for their records. Which copy of the DEA Form 222 is forwarded to the DEA? Said copy 2, you would be correct. C3 drugs may be kept openly on the pharmacy storage shelves. That is true. Only C2 drugs need to be in a locked cabinet.
Looks like we reached the end of today's presentation. So this is the end. So coming up is part 3 of 3 of drug regulation and control. And once again, thank you for joining me, and I hope you have a wonderful day.